My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What. Again, we're here to explain and have Frank talk about your health and taking control of your health for a better, happier, longer life. My production assistant told me that on my last broadcast that I said something about smoking and raping. I was supposed to be smoking and vaping, and then we went into the ED segment. So it really wasn't meant to say raping. Raping is not something we talk about or has anything to do with this program. Smoking and vaping. So reduce your health risk by stopping smoking and vaping. Unlike alcohol, there is no safe consumption of cigarettes, tobacco products, or vaping. So with that, we're going to go into genetics versus lifestyle. How much do they affect your health, and what can you do? The best predictor of your health and your longevity is truly looking at your family tree if you know a lot about their health. And you certainly should know many people about their parents, mother and father, and hopefully some about your grandparents, aunts, and uncles. And that'll give you some idea of what longevity potentials are there. But you also have to mix that together with lifestyle. Just because your grandmother lived to be 104, she might have lived a very different lifestyle than you do. So you might not make it to 104. Or your great uncle that died at 38 with a heart attack doesn't mean you're going to die at 38 of a heart attack. You may have a far healthier lifestyle. So let's look at those two together. The old saying is genetic loads the gun, but environment pulls the trigger. And that's really how this works. The development of disease in humans is really a complex interplay of genetics and environmental factors. And we haven't sorted all those things out, but we know there are certain things that are issues. I've mentioned before, if you have mold in your house, chronic mold, especially certain black molds, then you need to be really cognizant of that. And sometimes that can be behind the walls of the house you bought or whatever. But if you're constantly having allergic symptoms and that, and you have air cleaner or whatever on your heating and air conditioning system and you're still having issues, then you need to find out if that issue is environmental. And it could be outside allergies, could be inside inflammation causing agents. It could be hobbies. People don't realize if you're out painting in your garage all the time without ventilation, especially if you're using non-water-based paints, and even water-based paints have chemicals in them other than water. So you need to be really careful. Follow the directions, follow and look at the warnings, and be careful of those things. If you're a DIYer, which is very popular, and there's nothing wrong with that, but make sure you're in well-ventilated spaces, that you do not saw cement containing products without proper respiratory protection in ventilated areas. If you're painting, you've always got to be aware of that. The glues and adhesives you use can be issues. If you solder or weld, again, there's precautions you need to take. Those things can really cause long-term health effects. Spraying your house with certain pesticides or treating your lawn with certain biocides or herbicides or your garden, follow those directions carefully. Usually they can be used very safely, but not if you're careless. And you need to make sure you don't have skin contact, that you don't have inhalation of those chemicals, and that you don't have ingestion of those chemicals. Speaking of that, food and drink are a source of many of the things we're exposed to. There's plasticizers in all the bottled drinks that we indulge in, from bottled water to fruit drinks to all kind of things that you drink out of bottles have plasticizers in them. You have to be careful, especially out in the sun. They'll break down and contaminate the fluid that you're drinking. Lead in paint And if you've got an old house and it's shipped up, you've got to watch, especially if you have kids that are in developmental stages, from infants to teenagers, that can severely affect permanently their ability to learn, their IQ, and a lot of their social development even. So you've got to keep them from ingesting that accidentally. So there's other things like heart disease and diabetes and cancer, and the relationship between genetics and the environmental exposures are even more complicated, and they can be very specific. But I can tell you this: if you want to get cancer, especially lung cancer and other types of cancers or heart disease, smoke, vape, or gain a lot of weight. Those three things, as well as substance abuse and excessive drinking, can guarantee you that you're going to have issues and that you're going to affect your ability to not only live a longer life, but to live a high quality life. So you've got to be careful that you don't have an unhealthy lifestyle. And stress is a killer. So if you've got chronic stress, you need to find a way to have less anxiety. And some people are just more anxious by their nature, which is part of their genetics. So if you notice your mom or dad are always very nervous, or either one, or your grandparents, that you may be prone or predisposed to having anxiety. So you're going to have to be more careful about those things. So with that, we want to make sure you've got effective prevention and treatment strategies. Talk to your healthcare provider for specific advice. Now, let's look at some things. We talk about yearly physicals. One of the things I'm big on is you can look at people, you can do certain things, you measure blood pressure, etc. But when the rubber hits the road is when you get a blood test. And your yearly blood test can include a complete blood count, CBC. That's a number and type of blood cells in your body, including red cells, white blood cells, and platelets. And that helps detect infections, anemia, or other blood disorders. Very important and are included in almost every set of blood tests. The basic metabolic panel is a BMP. And you need to talk to your physician about these things. You're going to need those. That test measures your blood glucose or sugar levels, your electrolyte levels, such as sodium, potassium, and chloride, which are very important to be in balance, and your kidney function, such as creatinine and blood urea nitrogen. That helps you detect early kidney disease, diabetes, and other metabolic disorders. Detecting these early can make the difference between serious disease that is difficult to treat versus something that is fairly simple to prevent. So be careful about these and ask your doctor why he's doing the blood test he does, or your healthcare provider. The comprehensive metabolic panel, that includes the BMP, the basic metabolic panel, but it also adds liver function tests. So you want to look at those because they'll help detect liver disease and other conditions. If you have ever had hepatitis, if you've ever had issues with substance abuse of any kind, drugs or alcohol, you definitely need to add those liver tests to make sure that your liver is functioning well. Remember, everything, they call it the first pass, that goes through your stomach and intestinal system that is absorbed into your body, into your blood, goes through the liver first. And then it's excreted through your colon or through urine in your kidneys. So those are issues that we always have to look at that have high exposures to a lot of concentrated toxins. Lipid panel, that tests your cholesterol and your triglyceride levels. We know there's good cholesterol, bad cholesterol, and then triglycerides. These are a rough measure. Even if I've had high cholesterol since I was 16 years old and weighed 117 pounds. I had almost the same that I have today a few years later. So all my life I've had that. So I have to be careful. I have to run additional tests to make sure that I'm not at risk. And you have to make decisions whether you're going to take medication to lower your cholesterol levels. And again, the ratio of good to bad is very important. You need to talk about those things with your healthcare provider. Thyroid stimulating hormone. That's a test if you think you have thyroid problems at all. If you're feeling sluggish, you're gaining weight, or if you're very hyped up and you're losing weight, then you might look at the thyroid. Your healthcare provider may want to look at that to make sure that your thyroid hormones are in check. Your hemoglobin A1C test, again, blood sugar. So you need to look at that to make sure that you're not pre-diabetic or you're developing diabetes, because you can prevent it or even reduce your need or eliminate your medication for type 2 diabetes if you can reduce your weight, increase your exercise, and be careful about your diet. High blood pressure. You want to make sure that your blood pressure, if it's an issue, and it's not just an issue when you're at the doctor, get a good blood pressure cuff, look at it regularly, be careful how you measure it, follow the directions, and whatever you do, reduce your salt intake as well as your weight, and you'll see big changes in your BP most of the time. Why is blood pressure a problem? Because as your arteries and veins accumulate lipids, fats, they attach to the walls and the diameter becomes smaller and smaller. So the pump, your heart, has to work harder and harder. And that's why your blood pressure goes up. It's the resistance against those walls of the arteries and veins. And those become hardened, so to speak, over time because they become stiffer with age and exposure to those fats. So the best way to prevent cardiac events is to keep that blood pressure low, your salt intake down, your weight under control, and your exercise level up. Vitamin D test is important, and calcium, especially for women, because that's important for bone health and immune function for both sexes. So vitamin D tests are nice to have in your blood panels. With that, the other test that you'll get that's even simpler, it doesn't involve a needle, is your urinalysis. Urinalysis has 3 parts: a visual examination, a dipstick test, and that's not any kind of commentary on your IQ. It's a dipstick, literally, that you put into the urine, and a microscopic examination. They're looking for color, clarity, and odor. It's almost like diamonds, but a little different. But what you're looking for is any abnormal color or cloudiness, because that can indicate, or color, such as blood or pus or foreign fluids in your urine. The dipstick test looks at presence of certain substances such as glucose/sugar, proteins, ketones, and nitrates. If you have abnormal levels of those, it's a quick pick and easy pickup on early kidney disease or development of diabetes. So very important to have those on a yearly basis, and comparing them year to year gives a great baseline for your healthcare provider. Then you look at microscopic examination for people like me, pathologists. That's what we do. We look for red blood cells, white blood cells, bacteria, or other cells or substances in the urine, because that can indicate a urinary tract infection that may be long-term, low level, that you don't even realize there's pain involved, and yet it's causing issues with your urinary tract. So you want to definitely look at those, or kidney disease. So make sure you look at those. And we can go into our last topic of the day, which is diabetes, type 1 diabetes. You're born with it. Your immune system attacks and destroys the cells in your pancreas. It affects your insulin level. Insulin is released to utilize your blood sugar. If not enough or too much is released, then you've got an issue. Usually blood sugar raises because you don't have enough insulin. That's called diabetes. If it's the other way around, where you don't have enough insulin and too much blood sugar, then you can end up with things like hypoglycemia. So you need to see by your provider will know if you have type 1 diabetes early in life. But type 2 is the kind that most people, it's the most common form, and the one that people develop over lifetime. And again, keeping your weight in check, keeping a regular movement. And this doesn't mean you have to hit the gym. It just means you have to keep moving. Just move, because you're going to wear out long before you rust out. So are you going to rust out long before you wear out? Got that right. Dyslexic, but still, you're definitely going to rust out before you wear out. So keep yourself moving. Don't worry about, I'd rather have some overuse injuries in my joints than I would have a heart attack. So with diabetes, it's really important to keep moving. And you've got to watch your diet. You've got to get rid of those. Well, alcohol is a terrible source of ethanol, which is obviously becomes sugar in your blood and causes terrible spikes. Sweets, snacks, all those things diabetics can't eat. If you don't eat them beforehand, you don't get the diabetes and you don't destroy the nerves and the blood vessels. So try to keep those carefully. If you're excessively thirsty all the time and you're well hydrated, or if you have to urinate a lot, those are signs that you may have problems with blood sugar. You can be like me. My tests always show, since I've been a kid, excess glucose in my urine, but I'm not diabetic. I am somewhat hypoglycemic, but that's not the cause. The cause is my filter in my kidneys, in my nephrons, part of the renal tubes in the kidneys. My screens are bigger than your screens, and they let some bigger molecules back out that aren't reabsorbed, like sugars. So I've got to be really careful about my diet and eating regularly, eating several meals about every 4 to 5 hours, and making sure you fast at least 12 hours every day. Stop eating at 8 o'clock at night if you're going to eat at 8 in the morning. With all those things, you can have a happier, healthier life and prevent some of the common problems we have every day in America. Have a great day. This is Dr. Frank with Frank Talk About Your Health. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.